Picture this. You're out for a peaceful hike. You feel a tiny pinch on your leg, and without even realizing it, you've just become the host to a microscopic Trojan horse. We're talking about a virus so incredibly deadly, it demands the highest level of biosecurity containment on the entire planet. Welcome to this explainer. Today we're going to decode one of the most formidable pathogens on Earth, Crimean Congo hemorrhagic fever. Let's get right into it.
Here is our roadmap for today. We're going to cover the tick-borne threat, a global spread, the journey from bite to bleed, diagnosis and clinical care, and finally, prevention and future vaccines.
Kicking things off with Part 1, the tick-borne threat.
The history of this virus is honestly like an incredible medical detective story. We're dealing with an RNA virus from the Nairoviridae family, and as I mentioned, it's so dangerous it requires maximum biosafety level 4 containment. The very first clues of its existence actually date all the way back to a 12th century Tajik manuscript that described a mysterious hemorrhagic syndrome. Fast forward a few centuries to 1944, and a terrifying outbreak strikes Soviet military personnel in Crimea. Then in 1956, a seemingly identical fever is isolated from a patient in the Belgian Congo. But it wasn't until 1969 that scientists finally connected the dots, definitively linking these distant geographic strains to form the name we use today: Crimean Congo hemorrhagic fever, or CCHF for short.
So how exactly does this thing get around? Well, meet the primary vector, the hyaloma tick. And let me tell you, this thing is a terrifyingly efficient hunter. Unlike most ticks that just passively wait on a blade of grass for a meal to walk by, the hyaloma actually has eyes and can sprint up to 3 meters across the ground to actively hunt its host. No joke. Its evolutionary genius lies in its dit-tropic life cycle. Instead of needing 3 different animal hosts to mature like a normal tick would, it's adapted to only need 2. By skipping a host stage entirely, it drastically increases its survival rate and the speed at which it can spread the virus.
But here is the really crucial point, and it's the stark contrast between how the virus affects animals versus humans. When this tick bites animals like wild hares, sheep, cattle, or even ostriches, those animals act as completely asymptomatic Trojan horses. The virus rapidly amplifies in their blood, but they don't get visibly sick at all. But when a human gets infected, the story takes a very dark turn. It leads to an incredibly severe infection characterized by vascular leaks and a highly fatal hemorrhagic syndrome.
Moving right along to Part 2, a global spread.
We can actually see a major shift in the virus's geography by looking at Turkey. Prior to 2002, clinical cases weren't officially recorded there, but following a major outbreak of severe fever in the Kelkit Valley between 2002 and 2003, Turkey rapidly became one of the most highly endemic regions in the world for CCHF. It just goes to show you exactly how fast this virus can establish a brand new stronghold. So, why is it spreading so fast? Well, it's largely driven by climate change. Warmer temperatures in the spring and summer are actually increasing the active hunting behavior of these ticks. When you combine that with human ecological alterations like changing land use and even migratory birds acting as long-distance tick carriers, the threat is definitely growing. The virus has now breached its historical corridors in Africa, Asia, and the Middle East, and is starting to emerge in new European regions, including places like Spain and France.
Now for Part 3, from bite to bleed.
The primary transmission route is, as you'd expect, through tick bites, or honestly even just crushing an infected tick with your bare hands. But there's another major risk vector, which is slaughterhouse and farm exposure to infected animal blood. And perhaps more alarmingly, CCHF poses a severe hospital-based or nosocomial hazard. Healthcare workers are at extreme risk of secondary transmission through accidental exposure to the blood and body fluids of infected patients.
And that brings us to a rather terrifying number: the case fatality rate. Depending on the specific outbreak and the local healthcare infrastructure, anywhere from 5 to 40% of infected individuals will not survive. That's a massive percentage, and this grim statistic highlights exactly why rapid medical intervention is absolutely critical.
The clinical course of the disease is aggressive, and it progresses through 4 distinct phases. It always starts with a silent incubation period, which is then followed by a pre-hemorrhagic phase. This one brings vague, flu-like symptoms, things like high fever, muscle aches, joint pain, and vomiting. But then it plummets into a dramatic hemorrhagic phase. This is marked by massive vascular leaks, internal bleeding, severe bruising, and hemorrhaging from mucous membranes that can rapidly lead to shock. For those lucky enough to survive this onslaught, a long convalescence or recovery phase follows.
Behind the scenes, the virus is wreaking absolute havoc on your internal systems. A quick look at a patient's lab results paints a pretty grim picture. You'll see plummeting white blood cell counts, which leaves the body totally defenseless, along with a dangerous drop in platelets, basically destroying the blood's ability to clot. At the exact same time, it causes a dangerous spike in liver enzymes, which is a massive red flag signaling severe acute organ damage.
Which leads us to Part 4, Diagnosis and Clinical Care. Because early CCHF looks a lot like many other severe fevers, getting a definitive diagnosis requires really meticulous laboratory testing. Blood samples have to be handled with extreme care to prevent hospital outbreaks. Labs rely on advanced molecular tools like PCR testing to detect the virus's genetic material, and antibody tests to see if the immune system is trying to fight back. And remember, trying to actually isolate the live virus itself requires that ultra-secure BSL-4 maximum containment lab environment. Now, while there is no universal FDA-approved magic bullet or cure for CCHF, aggressive supportive care is the absolute cornerstone of survival. We're talking about carefully managing fluids, electrolytes, and replacing blood products. Alongside this, the early use of the antiviral drug ribavirin has been widely utilized. Studies have shown it actually has demonstrable effects in lowering the viral load and aiding survival, especially when it's administered in the very early stages of the disease.
And finally, Part 5, Prevention and Future Vaccines.
On a practical, everyday level, if you ever find yourself in an endemic area and you spot a tick attached to you, physically removing it as soon as possible with tweezers is your best immediate defense. You want to pull straight up without crushing it and thoroughly cleanse the area. Following that, it's totally vital to monitor yourself closely for any flu-like symptoms for the next 10 days. If a fever or body aches do appear, you've got to seek medical help immediately.
Looking at the bigger picture to prevent future outbreaks entirely, researchers around the world are making some incredible leaps. Historically, there's been a regional mouse brain-derived inactivated vaccine used over in Bulgaria, but modern science is moving way beyond that. We're now looking at highly promising next-generation candidates. One of the most exciting is a DNA-based vaccine known as NPVax1. It's currently entering clinical trials and showing fantastic promise in animal models, which is a massive step forward.
I want to leave you with a crucial thought to consider as we wrap up this explainer today. As global warming expands the territory of the hyaloma tick, the geographic shield that once protected so many countries is rapidly fading. With our climate changing and the asymptomatic Trojan horses of this virus marching into entirely new territories, how quickly can our public health and vaccine infrastructure adapt to outpace this evolving ecological threat? It really is a race against time, and understanding the science is our very first step.